Hey, hi, everyone.
Hello.
A minute to load on. Hi, everyone. Welcome, welcome. We'll give everyone a few more minutes to get settled. Hi, everyone. For everyone who's still hopping on. And Crystal, let me know if you're having any issues admitting people.
Thank you. We are in the clear.
Perfect. Alrighty, well, we're going to go ahead and get started. Welcome, everyone. My name is Heather Poza. I'm the Internship and Job Development Specialist here at the Career Development Center. Thank you so much for joining us today to learn more about some of the career path options you can take in health and wellness. To give you all a brief overview of how this event is going to go today, we're going to get started by hearing from our wonderful panelists who have joined us here today. And then there will be time for you all to ask the speakers any questions you may have. Just please reserve your questions until the end. There will be a chance for you to ask them. And then lastly, Candace Schick, who's a staff member here on campus, is going to give a brief presentation about health and wellness resources and offices we have here at the beach. From her presentation, you're going to learn about different resources that you yourself can take advantage of. And you're also going to learn about the different offices on campus we have that you can reach out to for career mentoring, internships, and on-campus employment opportunities. So with that being said, I'm so excited to introduce you to our four panelists today. We have Dr. Ayla Donlin, Dr. Allison Pelletier, Inger Aponitis, and Dr. Stephanie Malaspina. So if all of you would please share your current job title, the company you work for, a little bit about what you do in your role and what your degrees are. I greatly appreciate it. If you want me to repeat those four things, I can. But Ayla, if we can go ahead and get started with you and popcorn from there, that would be great.
Sure. Thank you, Heather. And hello, everyone. I'm Ayla Donlin, as Heather mentioned. Let me see if I can capture all these things. So on campus at California State University, Long Beach, I'm the director of the LifeFit Center, which is a part of the Department of Kinesiology. I'm also adjunct faculty in kinesiology as a lecturer. So I teach some classes in kinesiology as well. And then outside of the campus, I own my own business, Ayla Donlin Wellness. And I saw on the screen, it listed me as the director of the LifeFit Center and a life coach. I'd actually describe myself, and my certification is in the area of wellness coaching. And the business that I own, Ayla Donlin Wellness, is a wellness coaching and consultation business. So I work with individuals, and I also do consultation with businesses. I'm working with secondary education as well to do some consulting in that realm. And that's a little bit more about my business background. My degrees, I have my educational leadership doctoral degree, so it's an EDD degree. I also have a Master of Science degree in kinesiology. And my undergraduate degree is in psychology and business, and I was one class away from minoring in Spanish as well. So I have a pretty eclectic educational background. I also hold certifications. I hold a personal training certification from the American College of Sports Medicine. I also hold their Exercises Medicine Level 1 credential. I'm certified through the American Council on Exercise in wellness coaching, and I also took their fitness nutrition specialist course. And I'm about to take their senior fitness specialist course as well. So I think I captured it all, Heather. Did I do it?
Yes, you did. I think if you could also just add in like a line or two about what you're doing in both of your job roles that you have.
Sure. So on campus, as the director of the LifeFit Center, I think it's appropriate for me to tell you what that is. So we're an educational and research laboratory. And the way that we provide education and research experiences for students within the College of Health and Human Services is we serve as a health and fitness facility for all faculty and staff on campus, and then for folks in the community age 49 and above. So historically, our specialty has been older adult fitness for community members. And we offer group fitness, personal training, wellness coaching, small group programs, and then individual exercise programs as well. And I oversee our staff. I have student assistant staff, both graduate students and undergraduate students. And then this semester we have 15 interns. So I'm overseeing all programs, all personnel at LifeFit. And then I teach in our kinesiology department. This semester, I have the joy of teaching KIN 157, Fitness for Living, and that's a general education class. So I have students from all across the campus learning about and applying the principles of fitness and wellness to everyday life. It's a class I love teaching. And then in the business that I own, Ayla Donlin Wellness, I see one-on-one wellness coaching clients. So again, we're working on the individual's fitness and wellness goals and mapping a roadmap and a game plan toward achieving those goals. And then I'm supporting them in that process. And then I do consultation with businesses as well for employee wellness mainly. For example, right now I'm working with an educational district in Arizona, and I do wellness workshops for their employees, and it's mostly secondary education teachers. So hopefully that captures what we were looking for.
It did. Thank you.
Okay.
Stephanie, you can go next.
Hello, everybody, and welcome. I am your representative from the physical therapy profession. So if you see my title on your screen, you see my name followed by PT. That's my license. I'll tell you how we get there in a minute. And then that's followed by my degree, which is a Doctor of Physical Therapy degree. Let's see. I talk about who I am, how I got here, and what I do now, right, Heather? Beautiful. So currently I teach in the Doctor of PT program here at Cal State Long Beach. I'm part of the professional practice series. In any healthcare education program you go to, it's not just about your hands-on skills to work with a patient, it's about how to interact with that patient. And so you will go to classes in those areas as well. And I teach that in the physical therapy program. I am also what's called our Director of Clinical Education. What that means to you guys, any physical therapy program that you go to, you'll be required to go on internships. And I'm the person that coordinates all the internships for the program here at Cal State Long Beach. I also have certifications related to specific patient care areas within the world of PT. I'm certified to work with patients after they've suffered any type of brain injury. And also certified to work with patients after they've suffered any sort of spinal cord injury. One of the great things about PT is you can specialize in a lot of different areas. More on that later. Let's see. So that's my patient care life. I've worked for almost 2 decades in the intensive care unit. Working with patients with the aforementioned diagnoses, also helping patients with respiratory issues, trying to get off of machines that help them breathe. That's clinical life. Professionally, I teach. I'm the Director of Clinical Education. I also teach licensed PTs how to teach students on their internship. I do that on my weekends. And I got into all of this, into teaching at least, because I wanted to help promote student success and not promote anxiety and depression and stress and poor coping strategies. And so also in my free time, I'm certified to teach mental health first aid, which some of you may be aware of if you've been familiar with our counseling and psychology services here on campus. Did I miss anything, Heather?
No, I think you
Beautiful.
covered everything.
So we'll popcorn it to the next person. Heather, I'll let you pick.
Perfect. Ingrid, you can go ahead and go next.
Thanks, Heather. Hi, everyone. I'm Ingrid Apinitis. I'm currently serving as a public health data systems analyst at the California Department of Public Health. I've been in this role for a couple of years now. It is a role born of the pandemic. I work on the data system that California uses to collect and manage all the data that's been coming in through COVID-19. And now as we expand to additional diseases to support the state's disease reporting requirements. So I'm part of the development team. I work on data systems improvements. So trying to make this data collection and reporting as streamlined and efficient as possible to help the local counties who are on the ground working on this disease have good data, and then also, helping make sure that the people who are reporting the data aren't overly burdened by the process. I think you can all imagine that with COVID-19, we had a lot of data coming in, and this certainly was problematic for the state of California. So as I mentioned, I work for this data system for the state. I've been working in various public health capacities. So I did get my bachelor's and master's in biology. And then I transitioned and got a master's of public health in epidemiology and biostatistics with a concentration in global health studies. My first full-time career position was working overseas in a global health setting in the Pacific Islands for a small ministry of health. Since returning to the US, I've worked at local health departments. So those would be like your county health department, for tribal health jurisdictions, serving both urban Indians and other American Indians across the state and across the nation. And now I'm currently working for the state health department.
Thank you so much. And Allison, we can go ahead and move to you.
Okay, hi, my name's Allison Pelletier. I am an LMFT, so a marriage and family therapist, and also a clinical director of a rehab, so dual diagnosis, mental health and substance abuse. So I kind of have a couple roles. I have a private practice where I see clients and work as an LMFT, and then I'm the clinical director, which basically oversees everything clinical, groups that clients are in. I oversee the case managers that work with the clients, and then I supervise all of our therapists here as well. We have a practicum program too for students who are becoming therapists themselves. So that's a really neat thing that we have going on too. Was there anything I missed, Heather?
No, I don't think so. I think you hit it all.
Okay.
Now we can really dive into all of our questions. So Stephanie, my first question is for you. And you touched on this a little bit, but with your doctorate in physical therapy, can you please explain what that process was like from the application to completion of your program, and if the doctorate is required to be a practicing physical therapist?
Of course, and great place to start. So a doctor of physical therapy program is anywhere from 2 to 3 years long. Currently, they can be all in person. There are many programs that are hybrid programs as well. And whenever a student is interested in, joining this program, each program has a different application deadline. There is a nationwide deadline. It's a nationwide application service that you can just Google search PT application service and it will come up. And you apply by their deadline on that. And then you also typically have to apply, for instance, at CSULB, you also have to apply to the individual school by their individual deadline as well. So 2 deadlines to apply. The application process, depending on when the start date of the program, you may know within 3 months, it may be a year before you know in terms of planning and when to apply given your current studies. Once you are accepted into the program, as stated, it's a 3-year program. Most of the first 2 to 3 years, most of the first half of that program is spent on campus or in front of your computer studying, doing what we call the didactic portion of the curriculum, where you are receiving all of the knowledge that you need to be a successful physical therapy provider. The last half or the last third of the curriculum is typically where the internships are. Every PT program requires you to go on at least 32 weeks, I believe, is the standard of internships. And when we say internships, we are talking full-time, 40 hours a week across any available schedule. You may be 7 to 7 some days, 10-hour days, 12-hour days, whatever it may be. But 40 hours a week in a partner clinic with the university, which has direct access to whoever is your internship supervisor. Once you graduate, then you register to take your board exam, very similar to physicians. And you take the board exam at one of those testing centers. You go in and it's basically a massive computer lab, and they know you're coming and they have your set exam on your computer. The board exam Takes most people anywhere from 3 to 5 hours, and you do find out within 24 hours if you pass. It'll be posted on a website. You can work before taking the board exam as a physical therapist license applicant. You can wait to apply for your license till after the board exam in whatever state you want to work in.
Great, that was really helpful. One question that just popped off in my mind when you were explaining all that, that required 32-week internship, can that be paid? Is it typically paid or is it unpaid?
It is mandated by the American Physical Therapy Association that physical therapy students cannot be paid for any internship experience.
Got it. Okay. I just feel like that's a good thing for students to know because it's such a huge time commitment that has to be unpaid.
Really glad you asked that question.
Good, I'm glad. All righty, we can now move on. My next question will be for Allison and Inger. Can you both please share with us what the main components and tasks of your job are? I know you both did briefly touch on this, but if you can maybe go a little more into detail. And then also, can you please share what your favorite and most challenging parts are about working in rehabilitation services and public health respectively? Allison, we can start with you.
Okay. Yeah, so kind of how I was explaining before, in this type of setting, we have we call it a care team. You can call it a bunch of different things. But that means there's a case manager and a therapist assigned to a client. And we also have a medical team. So I oversee everything clinical. So doing treatment team meetings with the case managers and therapists and going over okay, what is this client struggling with clinically? Not anything medical, because that would be out of my scope. But, for example, so-and-so is really struggling with their anxiety. And so when they sit with the case manager, they're maybe not reporting that. So then being able to consult as a team and figure out okay, so what can we do to help them? Well, we can teach them grounding skills and we can teach them, some breathing exercises. And then the therapist can go and help process what's really going on for them. So a lot of my role is to kind of oversee all the clients and the issues going on and help the teams to coordinate their care, make sure they're addressing issues, that they're not missing something. Let's see what else. Yeah, doing supervision with the therapist, so doing a lot of case conceptualizations, talking about clients and how, maybe different therapy approaches, what would be the best modality for a certain client. And then overseeing just the groups, the curriculums, I redid the whole group curriculum over here to make it more trauma informed, because most clients coming in have trauma. And I've seen a lot of rehabs not addressing that and just opening up clients and having them talk about their trauma and then leave for the day. And then they're stuck with themselves. So trying to make sure that, we set up a program that would help them to learn coping skills and, learn to deal with some of that stuff before they leave our care. And then the other question was favorite part.
Favorite and most challenging part about your job?
My favorite part is the therapy and supervising practicum students who are just getting into the field. I kind of get to be their first kind of supervisor that helps, ease them into running a group or sitting with a client. I get to really help mold them into the next therapists who are going to help, people in the world. So that's what is most exciting about my job. Challenging is always, going to be clients and just the struggles they bring in and having to, getting to know a lot of things about clients that, most people don't, all the trauma stories you hear that can be difficult to hear and take home. So it's a difficult field in that aspect for just how much you have to take on with clients. So I think that would be the most challenging part.
Thank you for sharing that. And now over to you, Inger.
Okay, so my current role is about 50-50, and it's becoming a lot more balanced. When I first started this position and we were really in, I don't know if it's the first or the second wave of COVID-19, when I started working for the state, Everything that I worked on was COVID related. And as I mentioned, things are starting to balance out a little bit now, which from a mental health perspective is really great for me. When I began working in public health, I was working on non-infectious diseases, so chronic diseases, tobacco control, diabetes management. So it's only recently that I started working in infectious diseases, which is really a high-paced environment to work in. So day to day, I mentioned that we're trying to work to make our data systems easier and more effective for the local health departments to use. So some of those things are like doing automatic flagging of duplicate records so that people are only counted once in our data system. Working to send, taking the case survey, which when COVID started was all done via phone, making that an SMS survey so that people can complete the data collection on their own time. Other improvements we've been working on, we integrate with other data systems. So if you are a disease investigator, you can pull up and see if such and such that you're talking to has been vaccinated for the flu or other diseases. So we integrate with our vaccine data systems and some of our other data systems here within the California Department of Public Health. And then really in particular, I'm focused on improving data collection within our demographic section. So for instance, sexual orientation, race, ethnicity, and gender identity. Trying to work to improve those so that they're more inclusive and they're more descriptive and accurately represent the demographic that we're working with. So that's kind of what I'm really passionate about in public health is addressing data equity. And what that means is making sure that individuals and communities have accurate, timely, and accessible data that they can use themselves to respond to disease conditions. And a lot of that passion for me has been rooted in my work with tribal health organizations, making sure that American Indians and Alaska Natives are accurately reflected in our data because data is tied to funding and funding is such a critical component of disease response. I'm going to take a step back further in how I kind of found my passion for public health. I kind of alluded to infectious diseases being a
Oh no, we lost her. I think she was kicked out of the Zoom. Hey, Crystal, if you see her name pop up, will you please add her back in?
Absolutely.
Thank you. It's a bummer. I feel like we were about to get such an amazing insight into how she found her path. For the time being, though, we'll pivot. Ayla, can you please share with the students any tips you have for identifying boundaries between how you identify boundaries between your patient's mental health when you're doing your wellness coaching and your own mental health, and like how do you compartmentalize the two?
Yes, I am more than happy to. And I see that Inger is back. I feel like maybe before I even start,
I
because
agree.
Inger was about to just drop some really great stuff on us. I will yield the floor.
Drop knowledge bomb. I was going to say the way I got into public health was a very non-linear journey. So I did my undergraduate degree in biology thinking I wanted to go into medicine. By the time I started taking MCATs and looking at that process, that goal was getting a little bit further away from me. At the time I was studying at the University of South Dakota and spoke with an advisor, said, I'm kind of interested in medicine, but I don't really want to work in a lab over the summer. So he directed me to a research group locally in Sioux Falls that did what he called population health. I had no idea what that was. This was a health disparities research center in Sioux Falls, South Dakota. Health disparities is understanding the differences in populations, disease distribution. So understanding why some people have higher disease burdens than other. So in South Dakota, a lot of the work that I did that summer as a paid student intern was to work with some of the tribes across the state. We worked with on rural women's health issues, and also got to work with Hutterite communities, which are similar to, for instance, Mennonite or Amish communities. So some really interesting and amazing populations that I got to work with there in South Dakota. And that really is where I found my passion for public health and understanding cultural impacts, historical impacts that have led to certain populations having the health outcomes that they are now currently experiencing. And that's where I'll end before I drop off again.
Thank you so much for picking up right where you left off. I appreciate it. And we always appreciate hearing about people's journeys into their current career roles, because it's not always linear. In fact, I feel like it rarely is for people. It certainly wasn't for me. So thank you for sharing that. And Ayla, will go back to you talking about how you compartmentalize your patients' mental health and your own.
Thanks, Heather. I appreciate that. And I think a great place to start with boundaries is that so much of that is dependent on scope. And so I'll take a moment here to talk about scope, because I would actually talk about all of my clients as clients and not patients, because I'm more on the preventive performance side of the perspective of the spectrum or continuum, as opposed to treatment. So usually if we're going to refer to folks as patients, then typically I would be a clinician of some sort, where I would hold a licensure delivering some form of healthcare service or provision. And because I'm on the more preventive and performance-based end of the continuum, I refer to all of the folks that I'm engaging with as clients. So at the LifeFit Center, we refer to the folks who are patrons of the LifeFit Center as members and clients. And then when I'm engaging in my wellness coaching or consulting business, I'm working with those individuals as clients. And so it's really important for me to very clearly define my scope of practice up front in all of those realms, but particularly in wellness coaching, right? The areas that are within my scope are to provide support and guidance and resources in the areas of fitness and wellness. So I'm not doing diagnostics, I'm not doing treatment plans as it would relate to mental health or physical health. Instead, what I'm doing is I'm supporting the client's goals and ambitions and providing accountability and structure along the way. So that part is incredibly important in terms of setting boundaries. So if I have a client who's indicating that they're having some struggles with mental health and they need greater support in the area of mental health, at that point, I would make sure that my scope was clearly defined and that I provided that client a referral to the appropriate provider. And so it's been important for me to expand my referral network so that I'm working with a lot of professionals like those on this panel, so that I can refer clients appropriately for whenever something is outside of my particular scope. So if I had a client that was indicating, that they were really struggling with mental health, and I felt like it was beyond my scope, at that point, I would offer a referral. There are some times where I think we can all relate to, having some mental health struggles throughout the last few years with the stress and angst that the pandemic would have brought on. So when it would be in areas where I felt like it was within my scope of practice to provide some support, then I certainly would do that. But I make sure that I very clearly define up front, both for myself and for the client, what that scope is and where that ends and when I would provide a referral.
Got it. Thank you. That was really helpful insight that I personally was not aware of. So thank you for that. Our next question is going to go to Stephanie. Can you please share what your day-to-day looks like and anything about the position or industry that initially surprised you? And here, I want to be transparent with students about expectations versus reality. For instance, like probably not knowing that internship has to be unpaid or little things like that. Not to be pessimistic, I just want everyone to have a clear picture as to what they're actually getting into once they graduate with their degree.
Understandable. So a typical day-to-day in the life of a physical therapist, whether you're in the intensive care unit or any sort of hospital-based setting, or you're in a clinic, like I'm sure many of you drive by every day on the roads, you head into work and you have a list of names and a list of what their doctor thought their problem was. So it would be Stephanie Malaspina, shoulder pain, let's say. And then from there, because you spent 3 years and you did those unpaid internships, you know how to look at this human being, this patient, as a body. You can probably, once you're done with your 3 years, you'll overlay the anatomy that you learn over this person that's standing in front of you. You'll learn how to assess the bones, the ligaments, the muscles, tendons associated with that, every structure in the shoulder, to try to understand what is causing their pain or what is causing their limitation in their daily life. From there, then you develop a hypothesis. It's pure scientific method every day, but you develop a hypothesis of what you think is wrong. And because you spent 3 years in school, you also will have ways to help them with their pain or help them to become more functional again. So that's what we would call a typical patient evaluation as a physical therapist. And so then you send that patient on their way, maybe with some stretches or exercises that they need to do at home after you schedule their follow-up appointment. And that's 1 hour. And so repeat that 4 times in the day, six times, 8, 10 times in the day. And at some point around all of that, you also need to figure out how to write the note that the program, your academic program, will train you how to write the write-up of what you did with that patient. So then that your clinic or the hospital gets paid by the insurance company. In terms of kind of anything shocking about the profession, and this is easily Google searchable as well, the cost to get a doctorate level degree after you've already gotten your bachelor's degree. So the cost of roughly 7 years of education, and then the salary that you will make when you graduate. And so whatever program, if you are interested in PT or honestly any healthcare profession, be sure to get those numbers. What you're expected to make in 3 years when you graduate or 2 years when you graduate versus the cost it's going to take you to obtain that skill set. That's the number one thing that most licensed physical therapists report as, nobody told me about this.
Okay, thank you. That is really helpful insight, I'm sure, for our students to hear. Yeah, thank you. So we'll move on to Allison. Next question for you. Can you please share how you got your first job in your current field? So in working in rehabilitation services, substance abuse services, were there any challenges that you faced? And if there were, can you share how you got past those challenges?
Yeah, so I've always kind of worked, in a field, like I started off babysitting, for example. So I've always kind of worked in a job where, I was working with kids at a gymnastics place. And so in going through school, they make you do a practicum, which is generally unpaid. So my first practicum site was actually at the Salvation Army over in Anaheim, working with those clients, which was quite a shell shock for the first clients to sit with. They're on probation or straight out of jail. So I kind of said I was never going to work in substance again after that. And then went and worked at a group home with teens and kids, and then slowly made it back into, a rehab with clients that weren't just on probation. They were, more motivated for treatment, which made a complete difference. What kind of got me into working in substance too is, I kind of alluded to it earlier, was the trauma piece. So I'm trained in EMDR as well, which is a modality specifically for trauma. But in this population, like I said earlier, there isn't a client that doesn't have trauma. And, you know, one of my kind of core beliefs is like, if we want to see the behaviors disappear in clients and actually help them, we have to address what's underneath it, which is generally childhood trauma or a traumatic event, where then they had to start using opiates. And, you know, we all know kind of about the opiate epidemic and how that harmed people. So that's kind of how I got into the field and why I've kind of stayed and why I'm still very passionate about it.
Thank you so much for sharing that with us. We'll go ahead and move on back to Inger. You know, all of the students obviously on this Zoom are currently in college, they're pursuing a degree. So I want to know, I know that you expressed that your path was not exactly linear, but you do have a relevant undergraduate degree for the work that you do now. So could you share like how you feel college prepared you for working in the industry of public health? And in your role specifically, what were any of those translatable skills you learned and now use today? And this can also be applied to your master's degree as well.
Yeah, good question. I work with colleagues, especially now for the California Department of Public Health and our data systems, work with colleagues from a wide range of backgrounds. We all work within public health, but we have social work backgrounds, psychology backgrounds, and degrees in psychology. I work with people who have software backgrounds. And that's what I really love about public health, is that it's so multidisciplinary. So after my experience in South Dakota, an introduction to public health, I made that choice to go back and get my master's in public health, at which point you pick a concentration, could be community health, epidemiology, biostatistics, environmental health, health policy. There's a number of concentrations in public health that you can choose from. I kind of landed in epidemiology just because that was the concentration offered at Oregon Health and Science University, for which I was a resident of Oregon. So it made sense for me to pursue a graduate degree there. Went through a pretty intensive 2-year program in epidemiology and biostatistics. So a lot of math, a lot of data, a lot of numbers. I cried during some finals on my biostatistics. It was really hard, but I'm very grateful for that additional classroom education, just focused on data. Epidemiology is one of the cornerstones of public health, and you can't really fix anything that can't be measured. So I think that having that background in epidemiology, along with just having a great title, just does serve me really well. I like numbers anyway. I like crunchy numbers, both in my personal and professional life. So like I said, I think that was a really tough course to follow, but really did set me up well for a career in public health.
Thank you for that. Yeah, I mean, it certainly sounds like it. Okay, our next question will be for you, Ayla. What are trends that you're seeing in terms of different skills among new candidates that are applying to work in the field of wellness coaching, similar to the work that you do for the LifeFit Center as well? Like, if you were to hire a student assistant, what are the strengths, weaknesses, skills that you'd be looking out for?
Yeah, thank you, Heather. That's a really good question. I'm gonna go back to scope for a minute. I feel like that's going to be something that maybe is a key talking point of mine in terms of how do we define scope? And I think that's something that's really important to do as we talk about what skills we're looking for. And I'll address specifically your questions in terms of what are the trends around skills that are sought after in the fitness and wellness industry, maybe with wellness coaching specifically, and then what I would look for in students that would be applying to work or intern at the LifeFit Center. So in the fitness and wellness industry, something that makes that industry so different than the healthcare industry is that it's not regulated by a governing body. Whereas you heard Stephanie talk about like the American Physical Therapy Association, there's a governing body that sets clear and definitive guidelines around this is what it looks like to be a licensed physical therapist. Here are all of the requirements A through Z. In the fitness and wellness industry, it's still a little more fluid. And so defining scope will really depend on what are your education credentials, so what degree do you hold, and also then what are your certification credentials and which certifications are you seeking out. And right now in the fitness and wellness industry, the most top tier organizations and certifications are accredited by a third party. So there's a third party who comes in and looks at the certifying organizations, the certification exams, and makes sure that they're valid, that they're reliable, that they're covering the information that would be necessary to qualify someone in that particular realm or area. And that then defines scope, right? So based on my educational background, my certification background, my continuing education, that covers my scope of practice, whether that's as a personal trainer, a group fitness instructor, a wellness coach, on and on. And the fitness and wellness industry is quite broad. And so I'd say as far as addressing what skills someone might need to really develop if they were going to go into the area of wellness coaching, which has really expanded in the last 5 to 10 years. First, you would want a background that you felt would really set you up to have the scope of practice that you would want to, because with wellness coaching, you're going to want to get certified, and you'll want to get certified by an accredited organization, and the certification itself should be accredited. And that then would help to define your scope, but you can build on that by what your educational background would be as well, and then what you pursue in terms of continuing education. So the skills would be the skills that you choose and develop during your either bachelor's or graduate program. And then also the skills that you acquire through your certification exam and continuing education. I think something that is expected now in the field and realm of wellness coaching is the ability to offer sessions in hybrid ways and formats where you can deliver in-person coaching, but you can also deliver virtual coaching. So much of our lives are lived in these spaces now, right? And or a hybrid approach to that. And there are a lot of different softwares available now, like wellness software and personal training software that makes program delivery in a virtual space so much more accessible and so much more efficient. And so there would be the expectation that someone was proficient in utilizing software, developing programs, and delivering them using the software as well. So you need to have effective communication skills in person, virtually, on the phone, via email, but you also need to have the certification, credentialing, and training, and then the ability to engage with software as well. So those are some pretty specific skill sets, and all of that would apply to what I'd be looking for in students who are looking to be employees or interns at the LifeFit Center. We're going to ask at minimum that folks have a CPR, AAD, and first aid certification. And then we're going to look at what degree program that they're pursuing and how an experience at the LifeFit Center could best fit with that or support that. And then depending on what the individual was interested in leading at the LifeFit Center, group fitness, personal training, et cetera, we would require the appropriate certification to deliver that service.
Perfect, thank you. I'm sure there are some students who have already had the interest sparked in them just from hearing you speak today. So that's really, really helpful for everyone to know. Our next question will be for Stephanie. What are your top tips for our students as they intern and work in physical therapy, physical health? Like for example, how would they increase their chances of being hired full-time or getting a great recommendation from one of their different practicums or internships during the program?
So the biggest tip that I can provide is being flexible. Now, being flexible is an attitude, and each human honestly demonstrates being flexible, demonstrates that attitude in a different way. They behave in a certain way that's consistent with the attitude of being flexible. When you're out on your internships, the physical therapist that you are working with is not only looking at how you work with the patient, but they're also looking at your ability to become a professional in the field that is physical therapy and give back to that field. And if you go into, for instance, if you go into grad school, you go into all of your internship opportunities and you only want to work with one specific patient population, you're going to have a very small skill set that doesn't make you very marketable when you're applying after graduation. So be open, be flexible, and figure out ways to demonstrate that to your faculty, to your internship supervisors, and to future employers.
Thank you so much. That was really helpful. A little bit more of a piggyback off that too. Do you have any recommendations for things outside of internships that students could be doing to increase their value as a job candidate?
So even as a graduate level student, I know we're asking so much of you Monday through Friday, just for the curriculum or just for your internships. But you can pursue certifications in areas of interest. One of the very common ones in our field right now that students are pursuing is certifications to work in men's and women's health. Pelvic health, so dealing with issues of whether it's the sexuality issues, urinary tract issues, anything with the genitourinary system. There are proven treatments that physical therapists can help with, and many of our students take their own time to go and attend classes, continuing education classes, to get more information in working in that area. So that would be one thing. Keep on the lookout for any sort of extracurricular educational opportunity. So there are tons in the physical therapy profession, there are tons available, and it's not just to licensed therapists, it can be students too.
That's really helpful. Just to know that they can have very career specific opportunities available to them without having finished the program yet. Always helpful. Inger, next question for you. What are some popular entry-level job titles that our newly graduated students should be looking out for on LinkedIn, other job boards, for careers in public health?
So my first paid position in public health was as a research assistant. So that's a really good job title to look for, or project associate. That might be another good one for if you're looking to work more in a nonprofit or research organization. You might find some of those jobs at local universities. If you want to work for a public health department, like Long Beach has their own public health department, LA, Pasadena, you might look for a health educator position. When I worked at the County of San Luis Obispo public health department, I was a program manager for tobacco control, and I had 4 health educators that worked under me, and they did a variety of roles. They worked in the classroom with students to teach about vaping. We did compliance checks with retailers, going around and making sure that smoking laws were being enforced around the community. We met with local lawmakers to educate them about tobacco use and vaping, and gave them options for local ordinances they could implement. So health educator sounds like a pretty basic role, but it can really vary depending on the program you're working for, and that's a really great entry-level position.
Thank you. That's helpful. I know some of those job titles can seem super vague and super broad, so it's always good to know like what to actually type into that search bar to get the ball rolling. So thank you. Next question will be for you, Allison. How would you advise students to approach getting experience, whether that's internship, unpaid, non-paid, or a job, or even a volunteer position in rehabilitation and substance abuse services?
Yeah, so if you guys are looking for experience in this field before you even want to start like a master's program, they have an entry-level job at the detox residential houses. They either call them a support staff or a behavioral technician. It's really easy to get trained. We kind of train you in it. You'll do like a online course about law and ethics and some education about addiction. And then that's kind of an entry-level job straight into the detox residential house, where you get to see clients come in, detox. A support staff's role is kind of to support in the house, whether that be with clinical. You'd work with all the therapists in the house, the case managers, they would work with me. They do rounds, they check on the clients, they would do, make sure to set up appointments with doctors. They just kind of help support everywhere. And so this is a great kind of entry-level job to get exposure to the medical side, the clinical side, just how the whole system works, the operational side. And that would be a great way to learn and see like, oh, okay, I really actually like the medical side and I want to like become a medical assistant or go into psychiatry, or, I don't want to be a therapist. I'd rather be a case manager and work towards that. So that's that first kind of entry level that would give you exposure to kind of the whole system, and help you learn if that's something that anyone would be interested in. So.
Thank you again, super, super helpful. And our last two questions here, because we're kind of coming to a close here for as far as our panel goes, are going to be along those same lines, just so Ingrid and Ayla, both of you know. So our next question will be for you, Ayla. Similar to the last two questions also that Stephanie and Allison have spoken about, what are your top tips for our students as they look for internships in health and wellness? And do you also have any recommendations for things outside of internships that students could be doing to increase their value as a job candidate?
I do, and I'll start with addressing the latter part of the question as far as what opportunities to seek. I think once you start to get to a feel for your niche within fitness and wellness, you can start to pursue some certification, some continuing education in those areas, and that would put you a step ahead as far as already holding a certification to go into internship or employment opportunities. And then I'll go backwards a little bit to address the first part of the question in terms of what you might want to look for. So in the fitness industry, there are different areas or segments of fitness that you could explore. You could explore corporate wellness and fitness, which is supporting employees of a business. That's an area that you could work in. There's commercial fitness, like an LA Fitness, 24-hour fitness, YMCA. That's an area of fitness and wellness that you could explore. And then there's special populations. So you might be working with older adults in a special population. You might be working as a medical exercise specialist, and you would need additional training and credentialing for that. And my advice would be to try to get exposure and experience in as many of those realms as possible, so you could start to dial in your niche and make decisions on which certifications and credentials, continuing education you may want to pursue. So I always encourage students to do a lot of dabbling in all of these different areas and to meet people and interview people who are doing things that you think you may want to do within the fitness and wellness industries, whether it's wellness coaching, personal training, and even if it's in more of the treatment-based side. So if you're interested in physical therapy, connect with a physical therapist, interview them, get to know a little bit more about what their day-to-day looked like. And Stephanie was describing that really well. And get to know the difference between the treatment side and the preventive side, and decide kind of which side you want to float on, or maybe if you want a little bit of both. And there are certainly individuals who are on both sides. So that would be some advice that I would have for students.
Thank you. Yeah, again, really helpful with I personally wasn't necessarily aware of also the difference between more preventative wellness care versus clinical care, almost like you and Allison could have your own partnership together of one starting with you, Ayla, and then possibly moving on to Allison if that was the next step. So very helpful to kind of have a broader picture of how everything comes together. And our last question will be for you, Inger, and along the same lines also as the last few questions. How would you advise students approach getting experience or a job in the public health industry?
Yeah, just try to get your hands dirty. I think it took me a long time to find public health, but once I did, it felt like the right fit. So, get into a public health department and see what that's like, and see if, you do enjoy working in this position versus that position. I was really fortunate. My first position with the Health Disparities Research Center, my mentors were really supportive of giving me exposure to a lot of the projects they were working on. So I got to really taste, a little bit of everything. Also, something that's really difficult for me because I would say data is really comfortable for me. Social skills are not so much, but both my kind of big changes in my career happened by network alone. So again, talking to my advisor at South Dakota and getting connected with the Health Disparities Research Center. And then when I was in Oregon doing my MPH, talking with my global health professor, and he says, well, I know somebody who works in Guatemala, and I also know somebody who works in Micronesia. And I said, well, set me up with them. I don't know where Micronesia is. I'm going to have to Google it on the map. But through that connection, I got my first full-time job out of college. So both of those opportunities were really fortuitous. And so I would just really emphasize talking to people, professors, mentors around you, and just, I don't think there's one perfect path. So just throwing everything at the dartboard and seeing what sticks.
Love it. And what I heard a lot of from that was networking and utilizing any and all resources that you have. So for all students that are currently on this Zoom, these speakers, you now have access to them through me or through them directly if they feel comfortable sharing their information. So yeah, network, and yeah, definitely utilize the people that meet, hear, speak for sure. Well, thank you so much, all of you, for answering all my questions, for sharing so much useful knowledge with our students. I am not going to open it up to any student questions. So if you either want to unmute yourself or post it in the chat, please feel free. But students, the floor is now yours if you have any questions before we move into Candace's presentation. If no one has any questions, I do have a few more that I could ask. Right, doesn't look like we have any questions right now. So one thing that I had wanted to ask you, Ayla, actually was, you talked about what your role is and everything, but specifically with wellness coaching, could you go over again, like you sign a client or, you bring on a client, how exactly does like a session go with them?
Yeah. Okay. I'll walk you through my intake process and what a session would look like. So before I engage with a client, they're filling out their new client paperwork. So they're filling out an understanding of what our coaching agreement is. There's also liability language, release of liability language in that agreement. I'm defining, again, scope of practice, scope of services, so that the client knows that very clearly up front. They sign that agreement, as do I. They're also agreeing to, what kind of session package they might want to look at. And all of that is a part of some dialogue that I have with them around what are their fitness and wellness goals. And then I provide suggestions in terms of what time frame might be appropriate for us to work together to support those goals. And the initial session then with them is really about clearly identifying their top fitness or wellness goals. And then from there, the next several sessions would be about starting to map out a roadmap or a game plan to work toward those goals. And there's all kinds of different tools and strategies that I use throughout that process, but it's a very client-driven process as far as outlining the goals and their own personal process toward pursuing those. So it's dialogue back and forth between myself and the client during the session, and that would be anywhere from 30 to 45 minutes.
Hey, good to know. Thank you for sharing more. We did have a student ask if it would be okay if they got in touch with, I think with possibly you all after the session. So I know that Stephanie and Allison have posted their emails in the chat. Inger and Allison, if you both feel, or Inger and Ayla, if you both feel comfortable, I really appreciate it. But if not, I'll go ahead and post my email in the chat right now too. So that way, if anyone has any specific questions, you can also direct them towards me, and I can share afterwards. Let's see, Allison, we have a question for you. Do you have any suggestions as to what a good entry-level job would be for a student wanting to become a therapist?
Yeah, I mean, so like I said earlier about like support staff, that's something you can do to just get acclimated to like a treatment center. Other entry-level jobs, I did ABA therapy for a while, working with children who have autism or any other kind of learning disabilities or like epilepsy. And that they trained you all in it, but you might just get confused between that modality. ABA is applied behavioral therapy. So they have protocols. It's you take down charts and data and run these programs that are created. So it's entry level, but it might not be a good view of what it would be like, you know, to be a therapist. Trying to think of what else. Yeah, I worked in some schools as like a paraeducator for a while. That was entry level. So all those kind of things sparked me kind of into, you know, getting a master's in clinical psychology. So hopefully that was helpful.
Thank you. Thank you for answering. And the students said thank you as well. I think we can actually just allow Candace to have a little bit more time with her presentation. So last but certainly not least, Candace Chick, who wears many different hats here on campus with regards to health and wellness at the beach, is going to give us a brief presentation. So I'm going to go ahead and share my screen again. Let's see. So, Candace, whenever you are ready, take it away. I'm going to go ahead and add a spotlight to you.
Absolutely. First, I just want to say, amazing panel. Great job, Heather. These are all amazing individuals in the industry. I was really lucky to meet some new ones today. I took my own notes over here. So I'm just honored to be a part of this space and to help out all of our students with some more resources that we have available on our campus. So thanks for having me, Heather. And I'm honored to be in this space today with y'all. As you all know, my name's Candace Chick, and I am honored to work here. I get to wear very many different hats. I also get to teach in the Department of Kinesiology and the Sports Management Master's Program. But the really fun job I get to do is help out with the mental health plan. So we're going to jump right in, and we're first going to just talk about where we all are. We're all in different places. So if you could cue me up, Heather, and play the video, and then we'll dive into some more resources and tools.
Perfect.
So thank you, Heather. We've made this over the summer, and why we made this video is because we really want everybody to know, all of our audiences, that we're all coming from different places, but we're all coming together as one on our campus at Cal State Long Beach. And with that being said, we need to have a variety of different resources for all of you in this space of health and wellness. And it's so great to be able to share these resources with you all in a minute, because you're all going to be us in a couple of years. So always being conscientious of who we are, what we bring to the table, and who we get to serve is such an honor. So I just want to say thank you for having us. And some of the things that is always great to add to your spaces and to your toolbox, because we all have toolboxes of how to manage this. You're all in a hard space right now. It sounds like we have students that are just entering the industry. We have students that are about to go hit the career. We have students that are trying to get opportunities in the industry. So with that being said, it's always great to have different types of tools. There's breathing tools that you can do on your hands, breathing in and out, which is a great one that I practice with my daughter before she gives her mission project the other day. But another great one is grounding. Finding grounding exercises that you can do when you walk into a space where maybe you're nervous, that first interview, the third interview. So if everyone could just pick a color in the room, wherever they are, and count how many objects in that room or out your window or wherever, how many times do you see that color in that room? And then as soon as you kind of do it for, I don't know, do it for 10 seconds, chime it into the chat box. And I think I'm going to pick the color yellow because we're at the beach. So I had 7. Heather picked blue. We got teal at 11. Anybody else? We got yellow. Ayla, I was with you because your sweater. I had 7. You're higher than me. That's awesome. We had 29 with gray. Super cool. We have pink. Tickle me pink, 7. We have matching numbers, orange at 12. Anybody else want to chime in? So if you could go to the next slide, Heather. This is a very simple exercise that we can all do in any of our spaces at any time when we just want to get grounded. It stops that negative thinking. We all have 2 Jiminy crickets on each side. One is a happy one, one tends to be a negative one. And this is a way for us to come together and just bring down that thinking and redirect our thoughts. It can bring down our fight or flight, our stress mechanisms that are going on, and it rewires our brain to start thinking in a different pattern. So I just wanted to give you one of those cool tricks that's really easy and fast to pull out of your pocket at any time to have in your toolbox. And like I said, I use it with my daughter all the time, and she has no idea that it's a tool, but she always like, okay, this game again, Mom? So it's always great to play cool games and even share it with family members or friends before a test, even maybe when you're on campus. If you could go to the next slide, Heather, that'd be great. So let me talk about some of these resources. Beach Wellness is your hub. Think about it as a one-stop shop. Anything that you need when we're talking about health and wellness is at the Beach Wellness website. If you have a phone, skew the QR code. I'm going to share it at the very end of the presentation that you can go to the website. But this is where you're going to get, actually, I just shared it now with my email if anyone needs it. But this is where you can get all of your resources. Let's say you're having a bad day and you want to chat with someone. We have the crisis text line, 100% anonymous. You can text with someone. And then let's say at the end of the text, they say, hey, you know, we might have some more resources for you. They'll actually cue you back. Thank you so much, Heather, to Find Help Now. So Find Help Now is a brand new resource to our campus besides the crisis text line. So let's just make sure everybody understands. At any time, you can use the crisis text line here at Cal State Long Beach. It's 100% anonymous, and they will loop you back to Find Help Now if they find that maybe a resource could be helpful. Maybe what you're dealing with is some food insecurity. Well, Find Help Now, you can actually go through and sift through. They can give you resources that are on our campus and resources around in our vicinity that can help you with that need at that time. Maybe it's totally different. Maybe you have a friend that is going through a moment where they need extra support. You could put in those pieces and Find Help Now and get them those resources and share them those resources. So this is kind of our web page where we have a hub of resources, but the critical ones that I wanted to make sure I share with you all is the crisis text line and Find Help Now. We do have phone numbers as well. You can find these on your single sign-on. So if you go to your single sign-on, you are going to see Find Help Now with the parachute, and you're also going to see you at CSULB, which is our resources on our campus, and also web resources. This is more of a hub of wellness. So this is a place where you can go set goals. This is where you can go find more resources on our campus, or let's say you need to figure out how to pump up your energy right before you go into that job interview and learn how to do a power stance. This is also where you can go into this space and find amazing resources to support you in your well-being. If you could go to the next slide, please. Find Help Now I already talked about, but if you wanted to just go straight to the website, there's the QR code for a hot second. Heather also asked me to kind of talk about some of the resources that we have here on this campus where you could actually align and intern. We have basic needs. We have a lot of amazing interns that work in that area. That's for any food insecurity. We have the beach pantry also, which is right across from basic needs, where you can actually volunteer and help stock the shelves or do stuff like that. And just really start to maybe understand the public health area of CalFresh. So there's a lot of different categories in there that you could help out. There's BMAC, there's counseling and psychological services, CAPS on campus, and then there's also the Student Health Center. One of the big things that I can also offer to you all is we actually have a health and wellness advisory committee for students. So if any of y'all want to be on that committee, it is an open floor for all students to come to those meetings, and we feed you. So you're more than welcome. You all have my email now, and just send me an email and we'll get you signed up at the next meeting, because we really want to hear from the students of how can we support you in this space of health and wellness. And the only way to do that is to talk to y'all and hang out with y'all, and you tell us what's going on for us to support you. Next slide, please. So that's the big gist. You can actually stop the PowerPoint, but I did want to share one thing, is that the other day I was at a event, and at the event I happened to run into a Long Beach Police Department person, and they asked what I did. I said I help out with the strategic plan of health and wellness at Cal State Long Beach. And to make a long story short, they were kind of like, well, you know, we're struggling in that area, and we need to get more support, and we're trying to make a strategic plan. So what I have to say to all you amazing students on this call is there's a big need, and there are more than enough opportunities to get experience. It's just a matter of, I believe it was Stephanie said earlier, find your niche and get really good at your niche, but then diversify your niche. So really pick something, be great at it, and then flower out and find all these other opportunities that are going to be available to you, because they're everywhere we look right now in this industry. But at the end of the day, always remember, because I know all of these individuals on the call do it, because you can just tell with their presence, they take care of themselves first. So always make sure to put on that oxygen mask on yourself before you start giving to others, because this is an amazing industry. So we always need to practice what we preach and take care of ourselves before we start sharing with all the other amazing people that we have talents to share with them. So I thank you, Heather, for your time. I hope that was right on mark. If anyone has any questions, please feel free to email me, and that we can support you in this amazing space.
It was perfect, Candace. Thank you. And yes, students, please, as you can see, right before we wrap up, if you wouldn't mind completing the survey, and I'm also going to drop the link in the chat as well, just so we can continue improving our events moving forward. But yes, if anyone is looking for mentoring opportunities on campus, ways to get more experience, please don't hesitate to reach out to Candace or myself to be put in contact with different offices on campus. Remember, it can be as simple as walking into student health, and if they don't have any student assistant positions available, asking if you could shadow someone for a day or so. Like, all those different things are options. I'm sure with the people who are on this panel today that also work at Cal State Long Beach would, be open to talking with you about other opportunities too that may be outside the normal structure of a student assistant position or internship. So again, thank you so much to everyone for coming. I'm going to just stop sharing my screen. And thank you so much again to our panelists. I so enjoyed hearing everything you guys had to say. I'm sure our students did as well. So at this point, you're more than welcome to hop off, stay and chat, whatever you'd like, but this session is officially concluded. So thank you, everyone.
Thank you guys so much.
Yeah, of course. Our students are saying thank you to all of you in the chat, by the way. I learned even so much from you all today. There were things, I love putting on this series because I don't know always about the industries because I haven't worked in them. So I always personally love being made aware of all this information too. So I appreciate it.